Hi everybody, so this is Dr. Nam from Korea. I'm a professor of Department of Obstetrics and Gynecology in Ulsan University, Asan Medical Center in Seoul, Korea. When I was resident, but a long time ago, in 1970s, at that time in Korea, the laparoscopic tubular ligation is one of the very common surgery in gynecology because of the birth control. But it's a very primitive, laparoscopic surgery. But after the finishing my military service and become the obstetrician gynecologist, at that time, the real laparoscopic surgery is not done at all. But end of 1980, the real laparoscopic surgery on the adnexa was starting. So from that time, I'm trying to do the laparoscopic surgery because it's a minimally invasive surgery and less pain and less scar. It's very good for the patient. So. In Korea, laparoscopic surgery is very popular in gynecologic field, and but still in oncologic surgery, it's limited to some institute or some gynecologic oncologist. I strongly believe that laparoscopic surgery or robotic surgery in the future should be the standard surgical method for the gynecologic cancer. Definitely, laparoscopy is better and superior to the open surgery, and I think especially to find out the nerve, laparoscopic approach is more easier because the very clean operation field and the operation field is a little bit magnified, so much easier to find the nerve, and also less bleeding make a more clear the operation field and more clearly find the nerve. For me, the robotic surgery has no advantage for patient. Most benefit of the robotic surgery for doctor is easy to learn, short learning curve, and also very comfortable position, just sitting. But for patients, there is no benefit. More scar so far, and more trocar, and then expensive. No, I think no benefit for patient. Especially in Korea, the robotic surgery is not reimbursed by insurance.
Right.
So patients should pay a lot of money from their own pocket. That's the problem. But in the future, the strongest benefit of the robotic surgery is a short learning curve. So in the future, the young generation like to do that than the long time training for the conventional laparoscopic surgery. So I think it's going to move to the robotic surgery in the future. As you mentioned before, the single port surgery should be the choice in the future. I expect that some more convenient instrument will be developed by the company, or for robotic surgery also, they developed single port robotic surgery in the future. At that time, maybe single port is the main approach. In my department, about more than 80%, almost up to the 90% of benign gynecologic disease is managed by the single port surgery. My department is focused on the minimal invasive surgery, and also we are trying to conduct a clinical study comparing the single port to a conventional laparoscopy. And recently, I tried to conduct the comparative study between the the conventional radical hysterectomy versus the nerve-sparing radical hysterectomy, because we have no evidence actually the randomized prospective study in that field. So we are trying to do that.
Okay.
Actually, so far, APAGE was doing very well for, educating and young gynecologists in many countries to learn the laparoscopic surgery. And I think Professor Chilong Lee have a very good initiative on that, and also is leading very well of our society. And I think we can keep going on that way, to teach the young gynecologists and also to develop the new technique or new procedures and so on.
Okay, thank you.
Oh, you're very welcome.
That concludes our interview for today.
Okay, thank you.